Continuous bladder irrigation. Introduction. Continuous bladder irrigation can help prevent urinary tract obstruction after prostate or bladder surgery by flushing out small blood clots. It may also be used to treat an irritated, inflamed, or infected bladder lining. Continuous bladder irrigation requires the placement of a triple lumen indwelling urinary catheter. One lumen controls balloon inflation, a second lumen allows irrigant inflow, and a third allows irrigant outflow. The continuous flow of irrigation solution through the bladder creates a mild tamponade that may help prevent venous hemorrhage. Setup for continuous bladder irrigation. In continuous bladder irrigation, a triple lumen indwelling urinary catheter is inserted through the patient's urethra and advanced to the bladder. The urinary catheter allows irrigation solution to flow into the bladder through one lumen and flow out through a second lumen, as shown in the inset. The third lumen is used to inflate the balloon that holds the urinary catheter in place in the patient's bladder. Equipment. Prescribed sterile irrigation solution. Sterile tubing for use with bladder irrigation system. Drainage bag and tubing gloves. Antiseptic pad. 4-pole. Vital signs monitoring equipment. Gown, goggles, if required. Normal saline solution is usually prescribed for continuous bladder irrigation after prostate or bladder surgery. Large volumes of irrigating solution are usually required during the first 24 to 48 hours after prostate or bladder surgery to prevent hemorrhage and blockage. The irrigation solution may also contain an antibiotic. Preparation of equipment. Ensure that the irrigation solution is at room temperature to prevent bladder spasm. Procedure. Perform hand hygiene. Confirm the patient's identity using at least 2 patient identifiers. Assemble all equipment at the patient's bedside. Provide privacy. Explain the procedure to the patient to allay any fears. If the patient is receiving the irrigation solution for the first time, teach about potential adverse reactions and address any other concerns related to the solution. Insert the spike of the tubing into the container of irrigating solution bag. Squeeze the drip chamber on the spike of the tubing. Open the flow clamp and prime the tubing to remove air, which could cause bladder distension. Then close the clamp. Hang the bag of irrigation solution on the 4-pole. Continued. Perform hand hygiene. Put on gloves and, if needed, a gown and goggles to comply with. Standard precautions. Clean the opening to the inflow lumen of the urinary catheter with the antiseptic pad and allow it to dry. Insert the distal end of the tubing securely into the inflow lumen of the urinary catheter. Trace the tubing from the patient to its point of origin to make sure you've attached it to the proper port. Continued. Secure the urinary catheter properly to prevent movement and urethral tension, which increase the risk of CODI. Ensure that the urinary catheter's outflow lumen is attached securely to the drainage bag tubing to maintain a closed system, preventing disconnections that increase the risk of CODI. Open the flow clamp under the bag of irrigation solution, and set the drip rate as ordered. Continued. Secure the urinary catheter properly to prevent movement and urethral tension, which increase the risk of CODI. Ensure that the urinary catheter's outflow lumen is attached securely to the drainage bag tubing to maintain a closed system, preventing disconnections that increase the risk of CODI. Open the flow clamp under the bag of irrigation solution, and set the drip rate as ordered. Continued. Empty the drainage bag regularly, using a separate collection container for each patient. Use sterile technique, avoid splashing, and prevent contact of the drainage spigot with the non-sterile collecting container to avoid the risk of contamination. Measure the outflow volume accurately. It should equal or, allowing for urine production, exceed the inflow volume slightly. Continued. If the inflow volume exceeds the outflow volume postoperatively, suspect bladder rupture at the suture lines or renal damage, and notify the practitioner immediately. Assess the outflow drainage for changes in appearance and for blood clots, especially if continuous bladder irrigation is being performed postoperatively to control bleeding. Continued. Monitor vital signs as often as required by the patient's condition, increasing the frequency if the patient becomes unstable. Monitor urine output, assess the patient for abdominal pain, and palpate for bladder distension as indicated. Notify the practitioner of abnormal findings. Remove and discard your gloves and any other personal protective equipment worn. Perform hand hygiene. Document the procedure. Complications. Interruptions in a continuous bladder irrigation system can predispose the patient to infection. Obstruction in the urinary catheter's outflow lumen can cause bladder distension or spasm. Special considerations. Don't clean the periurethral area with an antiseptic pad. Instead, clean the Mayatowel surface during routine hygiene to reduce the risk of CODI. Encourage oral fluid intake of 2 to 3 L/day unless contraindicated by another medical condition.